started. We're still awaiting a Republican representative to begin as a subcommittee. Let me share some announcements. Welcome you all to this afternoon's session of the Assembly Health Committee. For those presenting bills, our custom is 2 witnesses per side, 2 in favor, 2 in opposition, with testimony of 3 minutes each, and additional witnesses who indicate their support or opposition by presenting name and organization only. However, we do often make accommodations, and one bill today we will have 3 witnesses at 2 minutes per speaker, and I'll indicate that when we get to that piece of legislation. We've been informed by the Speaker's office that Assemblymember Brian Nastandi will fill in for the Republican vacancy today. One bill removed from calendar this week is SB 1106 by Senator Yee. That's been removed from today's calendar. And then I'm going to read the bills that are on the consent calendar. These are proposed consent items. Any member of the committee, of course, may pull any item from consent. They are as follows. Item 1, AJR 42 by Mr. Solorio. Item 7, SB 1187 by Senator Strickland. Item 8, SB 1236 by Senator Alquist. Item 9, SJR 13 by Senator Oropesa. And item 11, SJR 15 by Senator Alquist. So those are currently on our consent calendar, and we are awaiting, as is the custom, for a Republican member of the committee to join us. I think I'll afford another couple of minutes out of courtesy, and if they are still not present, we'll proceed with hearing on the first bill. We welcome Assemblymember Smythe. We will now convene as a subcommittee. We do not have a quorum, and we'll begin with Senator Alquist. Please come forward, Senator Alquist. I believe you're presenting 2 bills this afternoon, and the first is item number 2. This is SB 56. Should work now.
Thank you. Yes, it's on now. Thank you, Chair Monick and members of the committee. First item is SB 56, Local Health Plan Joint Ventures. SB 56 provides what I think is a creative approach to providing health insurance coverage that could directly benefit several hundred thousand Californians and hopefully more. One of the key goals of healthcare reform is giving people better and more affordable choices for how they get their health coverage. Local county organized or operated health plans such as the Medi-Cal local initiatives and county organized health system plans, COES, currently provide cost-effective coverage to Medi-Cal beneficiaries and children enrolled in the Healthy Families program. These plans have the potential to provide low-cost, high-quality health insurance coverage in broader insurance market. To do that, the plans need to be able to integrate their operations and offer coverage on a regional, statewide basis, but currently they lack the authority to do this. The solution, SB 56, would address this problem by allowing the local initiative and county organized health system plans to enter into joint ventures with each other to provide health insurance coverage to individuals and groups. These joint ventures could include taking the form of agreements among the plans to share risk, to share provider networks, and or coordinate their offering of common plans in the individual and group markets. The plan would require the joint ventures to meet the same regulatory requirements that other health plans have to meet, which will provide an even playing field between these plans and among private commercial plans. This bill simply gives people more and better choices. I ask for your support, and I have some stellar witnesses.
Thank you, Senator. Before we go to your witnesses, we have a quorum present. I'd ask the clerk to call the roll, please.
Monning.
Here.
Fletcher. Amiano. Here. Carter. Conway. De La Torre. De Leon. Ng. Gaines. Hayashi. Hernandez. Here. Jones. Here. Lowenthal. Here. Nava. Perez. Salas. Smythe. Here. Strickland. Here. Nestande.
And I understand that we have your permission to have the three witnesses 2 minutes each instead of having two witnesses 3 minutes.
That is correct. So three witnesses, 2 minutes each.
Thank you.
Thanks.
Move the bill.
Thank you, Mr. Monning, and members. Jim Gross on behalf of the Local Health Plans of California, which are 9 health plans covering most of the state of California, including LA Care, San Francisco Health Plan, Inland Empire Health Plan, et cetera. With the changing face of healthcare, our plans, which are licensed the exact way that commercial plans are, follow all the same rules, do all the same things, envision opportunities to work together to offer competitive products in the marketplace. We have worked closely with the commercial plans on the language in this bill to ensure that indeed whatever venture was undertaken would follow all of the same rules that we all currently follow. It does not give us any legal advantage or regulatory advantage, but it does in fact clarify any questions about whether the local initiatives can in fact enter into these types of arrangements. And so we believe this bill will present further opportunities to offer competition in the marketplace, and we ask for your support.
Beth Capel on behalf of Health Access California, also here in support. The local initiatives were created as part of the creation of Medi-Cal Managed Care here in California, and they have evolved to serve children in healthy families. As we look forward to a world in which low and moderate income adults will have coverage, it makes sense that they should serve the parents be able to serve the parents of those children and other adults. We view this as a natural evolution of an existing structure that we have here in California, and an important opportunity for more competition in our health insurance market. And I want to point out part of the reason why this is a practical solution. If you live in San Bernardino and work in Los Angeles, or you live in Ventura and work in Los Angeles, or live in Alameda and work in San Francisco, right now your county local initiative only covers you in the county you live in. But lots of us cross county lines every day to go to work or for other purposes. So creating a structure that allows the coverage to go with you makes sense to us. Thank you.
Mr. Chairman and members, Willie Pelot, representing the American Federation of State, County, and Municipal Employees. For the outline that has been given you by Senator Alquist, it's a continuation of a process we started a few years back. We are now at the point of reaching a conclusion, and your vote today will make that a reality. We'd like to associate our comments with not only the Senator, but in addition to Jim Gross, as well as Beth Capel, who have been partners with us for years working on this concept. It is now a concept that's in your hands to move forward so it becomes a reality in the state of California to serve the population that is in need of the health care services, also to join in a partnership with the federal government. This is indeed a great day, and we ask for your strong support of the Senator's bill to move this concept forward.
Thank you. Now we'll move to other witnesses in support. Name and organization, please.
Randy Hicks, Californians for Disability Rights, and strong support.
Anne Marie Benitez with Planned Parenthood Affiliates of California in support. Thank you.
Gary Passmore with the Congress of California Seniors. We're in strong support.
Other witnesses in support? Any witnesses in opposition? Seeing none, any questions from committee members? Seeing none, would you like to close, Senator Alquist?
Ask for your support.
Thank you. There's a motion. Is there a second? There's a motion and a second. Clerk, call the roll, please. This is a motion to do pass and refer to appropriations.
Monning?
Aye.
Monning, aye. Fletcher? Amiano? Aye. Amiano, aye. Carter? Carter, aye. Conway? De La Torre? De Leon? Eng? Eng, aye. Gaines? Hayashi? Hernandez? Hernandez, aye. Jones? Jones, aye. Lowenthal? Lowenthal, aye. Nava? Perez? Salas? Salas, aye. Smythe? Smythe, no. Strickland? Strickland, no. Nastande?
That has 8 votes, needs 2 more. Senator Alquist, I understand.
Yes, I would like to, if that's all right with you, defer to Senator Lowenthal as he is on the Budget Conference Committee, and then when he is through, I'll present my second bill.
Great. I appreciate your courtesy on that. And Senator Lowenthal, if you'd like to come forward, we're going to now move to item 6, SB 1169, presented by Senator Lowenthal.
Are you going to take up on this next one?
Thank you, Mr. Chair and members. First, I want to thank my colleagues, both Senator Alquist, Senator Yee, for allowing me to present, and also Assemblymember Monning and the Chair for allowing me to go out of order. I appreciate that. Members, SB 1169 seeks to address 2 problems in mental health treatment. One, the more stringent standard for treatment limitations that are applied to mental health conditions when we compare them to physical health conditions. For example, plans and insurers often require daily prior authorization for intake for inpatient psychiatric care, but do not do it for other kinds of inpatient services with physical health conditions. Second, the second issue that we wish to address in this is that often claims are lost, there's slow responses to provider requests for treatment authorization in the mental health field, which often result in delayed payments and delayed authorization for treatment. Specifically, SB 1169 seeks to clarify mental health parity law to make sure that the treatment limitations that are applied to mental health illnesses are the same limitations that are applied to physical health illnesses. And 2, SB 1169 requires that healthcare service plans and health insurers provide a tracking number to a claim or provide a request for treatment authorization. They require that the healthcare service plans provide acknowledgement of receipt of any additional information for contested claims within 3 working days, and they require all the parties to use the tracking numbers in subsequent communications regarding the claim or any request for treatment. This tracking number, as we all know, is very similar to the one that any individual receives when shipping an item on either Federal Express or UPS. With me are witnesses in support from the California Association of Marriage and Family Therapists in support of the bill, and also others to answer any questions, technical questions that you have.
Thank you, Senator. We have a motion and a second. We will have 2 witnesses with testimony and support, and then following witnesses, name and organization. Please.
Mr. Chairman and members, Tim Shannon, representing the California Association of Marriage and Family Therapists. I'm going to hand it off to our executive director. I just want to underscore before I do, this bill does 2 very simple things. It creates a tracking number for health insurance policies like we currently have in casualty policies such as auto, and it treats the parity issue such that limitations are handled in the same way as coverage issues. And with that, I'm going to hand it off to Mary Remersma.
Mary Remersma, California Association of Marriage and Family Therapists, also past president of the California Coalition for Mental Health, the main sponsor of this bill. We are a co-sponsor, as is the California Psychiatric Association and the Mental Health Association of California. And we believe that this bill serves the public well. It helps to serve providers who frequently experience difficulties when they submit claims, and claims are regularly lost. The claim is made that authorizations were never granted. So these problems are regular occurrences with regard to submissions of claims. And as was previously stated, it deals with a problem with parity being fully recognized in the case of mental health. So I would be happy to answer any questions that you might have in regard to the bill or to explain the experiences that we all face as providers of mental health services, whether we be institutional providers like hospitals or individual providers as our marriage and family therapists, clinical social workers, psychologists, and psychiatrists. Thank you.
Judy Wolin with NAMI California and strong support.
Laney Hicks with Californians for Disability Rights and strong support.
Chris Rosa, representing the California Division of American Association for Marriage and Family Therapy in support.
Amanda Levy of the California Psychological Association, also in support.
Tom Riley with the California Academy of Family Physicians and Osteopathic Physicians and Surgeons of California, also in support.
Any other witnesses in support? Seeing none, we'd invite witnesses in opposition to please come forward.
Mr. Chairman and members, Maureen Higgins, representing America's Health Insurance Plans in opposition to the bill. Our concerns are with the provisions of the bill that assign the claims number and the acknowledgement of receipt. We believe that what the bill does is overlay a lot of requirements onto a system that already has requirements, and so they're unnecessary and burdensome. And they also have the wrong incentives in the system, which I'll explain in a second. There are several issues in the bill. The first is the requirement to assign a claims number. The issue here is that actually it's already done. Every health plan, every insurer already assigns a claims number. The problem that the proponents have cited is lost submissions. And if that's the issue, the assignment of a claims number doesn't do anything to solve that problem, because right now, an insurer or a plan assigns a claims number when they receive information. If the information isn't received, they can't assign a claims number. So if the issue is lost submissions and there is no receipt of it, assigning the claims number does not solve the problem. Right now, if a provider has a question, all they have to do is call the insurer and give the date of service to the enrollee and the enrollee's name, and they marry up the claims number at that point in time. The second issue is the acknowledgement requirements in the bill, and there are a couple of those. There's there's a requirement to acknowledge a prior authorization request. We believe that this is unnecessary because right now the current law on both sides, DMHC and DOI, requires completion of the entire prior authorization request within 5 days. So we don't understand the need for an acknowledgement before that. Secondly, in terms of claims, it requires an acknowledgement, an open-ended acknowledgement on a claim. Current law builds in an incentive to do electronic filing. Current law says that on the DMHC side, the insurers or health plans must acknowledge the claim within 2 days if it's electronically filed. Otherwise, it's 15 days. This overlays an undetermined time frame for another acknowledgement. The problem with that is the wording in the bill allows an opt-out for the provider for paper claims. So it incentivizes paper claims by putting a paper back and forth with the insurer into the law. The second thing is it talks about oral authorizations, which are actually prohibited under HIPAA. So we think it could actually be harmful by institutionalizing this paper claim process. It's also contrary to where everybody else is going. Federal health care law, the new federal health care reform law, is actually establishing a process to streamline and simplify and go electronic with claims processing for the very reasons the proponents are talking about. Let's reduce cost and reduce errors. That's the wave of the future. This bill goes contrary to that wave. The federal government is required by July 1st of next year to put that process in regulations. So for those reasons, we oppose the bill.
Thank you. Charles Bakke with the California Association of Health Plans, also in opposition. We believe the bill will unnecessarily increase administrative costs on plans. As my counterpart mentioned, it really does create a new paperwork blizzard that we believe is unnecessary. And again, to just echo the points about federal health care reform, we are dramatically changing the way we handle everything. over the next 4 years in our healthcare system, and a bill that puts into state law new prescriptive notification requirements that we're not really sure have that much value for consumers, just increases the paperwork blizzard and the cost for health plans. So for that reason, we're opposed. And then finally, I'd just like to note, we're really unclear about the amendments to the to the state mental health parity law that the author and sponsor are proposing. We're not sure why they're needed. Obviously, we have mental health parity already in California. Now there's a federal mental health parity law. So, we just, as this bill moves forward, and if it does, we really believe that this committee should focus on what that language actually accomplishes. And for those reasons, we are opposed to the bill. Thank you.
Other witnesses in opposition?
Thank you, Mr. Chairman. Maureen O'Haron, representing Delta Dental of California. We process 36 million claims annually, 99% on time. We're opposed for the reasons stated. Thank you.
Any other witnesses in opposition? Committee member questions? Seeing none, Senator, would you like to close?
Well, I urge your aye vote. I would like to state that the opposition talked about already having claims. Well, those are internal. Internal tracking numbers. What we're asking is that now every provider be given that tracking number also, and that there be an external system so that everyone can contact the health provider by using the tracking number. Right now, the providers do not have access at all to those tracking numbers. And so that's the first thing. And the second one is we're willing to work on amending or working with them to make sure that we have a system that flows quickly. The issue was, are we laying an additional level? We believe that we're not. We're talking about now only having the requirement for acknowledgement is on. Not only we acknowledge the first claim when you first do it. There's a time period that has to, in law, when the health plan has to acknowledge. We don't have a problem with it. The problem that we are addressing is any additional contacts with the health provider or health plan regarding any kind of contested claim. They get lost in the shuffle and never get responded to. And so we're asking that we clarify that and set some parameters. And with that, I urge your aye vote.
Thank you, Senator. We have a motion and a second. Clerk, call the roll. This is a motion do pass and refer to appropriations.
Monning?
Aye.
Monning, aye. Fletcher? Amiano? Amiano, aye. Carter? Carter, aye. Conway? De La Torre? De Leon? Ng? Ng, aye. Gaines? Hayashi? Hernandez? Jones? Jones, aye. Lowenthal? Lowenthal, aye. Nava? Perez? Salas? Salas, aye. Smythe? Strickland? Nastandi? Nastandi, no. Fletcher, no.
That has 7 votes. It needs 3 more. It'll be on call. Thank you, Senator. And we will now invite Senator Alquist to return on item number 3, SB 227. And as you're getting situated, I want to welcome Assemblymember Nastandi for joining us this afternoon. Thank you.
Hello again. SB 227, Federal High Risk Pool. If you are looking for health insurance coverage in the individual health insurance market and have a pre-existing medical condition, there's no guarantee you will be able to find coverage. The Federal Health Care Reform Bill makes available $5 billion for high-risk pools to cover uninsured people who have pre-existing medical conditions such as cancer, diabetes, heart disease. California is estimated to receive $761 million until January 1st, 2014. Governor Schwarzenegger has indicated to the federal government that the state will administer its own high-risk pool. This bill and companion bill AB 1887 by Assemblyman Vallines are sponsored by the governor. As you know, funding for high-risk pools have enjoyed bipartisan legislative support from both Republicans and Democrats. This bill will establish the framework for the state's Managed Risk Medical Insurance Board, known as Mr. MIB, to administer the federal pool. We are moving quickly on this issue because the federal money is available starting July 1st and only until January 1st, 2014. I'd like to take an author's amendment in Assembly Approps at the suggestion of Republican committee staff that renames the pool as the Federal Temporary High Risk Pool instead of the California Temporary Health High Risk Pool, and to add Assemblyman Jones as co-author. We will also be adding an urgency clause. I think I will stop there. I have some excellent witnesses.
Thank you, Senator Alquist. And just to clarify, is it your preference to have 3 witnesses with 2 minutes each on this bill, or 2 at 3 minutes each?
If they can stick to 2 minutes each, 3 of them, yes.
Okay. So again,
as a mathematician, yes, I would like it that way.
So, and I would just ask the witnesses, the first 3, you'll each have 2 minutes. And then after that, name, organization, and register your support. Thank you.
Mr. Chairman and members, my name is Leslie Cummings. I'm the Executive Director of the Managed Risk Medical Insurance Board, Mr. MIB, which operates the state's high-risk pool, the Major Risk Medical Insurance Program. I am here on behalf of the Schwarzenegger administration to speak in support of this legislation, which would give our board the authority to operate a high-risk pool on behalf of the federal government. We think that there are good reasons to do that. Right now, we don't know what the federal product will be and what they might be making available to Americans. We have some experience running a high-risk pool, having done so for the last 18 years. It's been one that's been woefully underfunded, so we look forward to the opportunity to making available to Californians coverage that will have a meaningful, comprehensive benefit level, and hopefully at prices that are more affordable than the coverage that we have made available so far. I'm happy to answer any questions that you may have.
Thank you. Let's hear from the other witnesses, and then we'll open it to questions.
Beth Capel on behalf of Health Access California, pleased to be here today in support of this measure as we are in support of Mr. Villain's measure, and pleased to have worked with both houses of the legislature and with the governor on these important measures so that we can get them operational by July 1 so that people who currently cannot obtain health insurance at any price are able to obtain meaningful coverage through this new high-risk pool. We think these are important measures and look forward to working with Mr. Villains as the bill progresses, as well as Senator Alquist. Thank you.
Mr. Chair, members of the committee, Gary Passmore with the Congress of California Seniors. We too have been engaged in the stakeholder conversations that Ms. Capel described. This is an important bill for our constituency because there are tens, maybe hundreds of thousands of people in the years prior to becoming eligible for Medicare, say in the late 50s to early 60s, who find themselves unable to get insurance in today's market. It is a bridge to getting us to 2014 when we will find broader and better solutions to deal with the problem, and we urge your support. Thanks.
Mr. Chair and members, Connie Delgado Alvarez with the California Hospital Association in support.
Other witnesses in support, you can either step up or use the floor microphone, whatever your preference is.
Thank you, Mr. Chair, members of the committee. Carolyn Gino with the California Medical Association. California's physicians are in support both of Senator Alquist's bill as well as Mr. Villain's bill, AB 1887. Thank you.
Charles Bakke with the California Association of Health Plans, also in support.
Alex Graves with the Alzheimer's Association, also in strong support.
Other witnesses in support?
Yes. Nina Weiler Harwell, AARP California, in strong support.
Dan Chick with HealthNet of California, in support.
California Chronic Care Coalition, in strong support.
Californians with Disability Rights, in strong support.
Tom Riley, California Academy, Family Physicians, strong support.
Seeing no further witnesses in support, are there any witnesses in opposition? Seeing none, questions from committee members? Mr. Jones.
I just want to commend the chair of the Senate Health Committee for her leadership in bringing forward this measure and doing so in such a timely fashion to make sure that we implement the temporary high-risk pool as quickly as possible. And I want to thank the executive director and her board for their leadership and for stepping up to the plate and taking on this task as well. And I'm pleased to be a co-author, and I'd like to move the bill.
We have a motion and a second. Some more questions? Mr. Fletcher.
Senator, I just want to thank you for working with us on the technical changes, and this is clearly a program that's much better run by the state at the state level. And so I'm happy to support this effort.
Thank you.
Any other questions or comments? I'd also like to offer my thanks to the author for your leadership on this, and to those of you that are working on implementation. So we have a motion on the floor. This is due pass and refer to appropriations.
Monning?
Aye.
Monning, aye. Fletcher?
Aye.
Fletcher, aye. Amiano? Carter? Carter, aye. Conway? De La Torre? De Leon? Eng? Eng, aye. Gaines? Hayashi? Hernandez? Jones? Jones, aye. Lowenthal? Lowenthal, aye. Nava? Perez? Perez, aye. Salas? Salas, aye. Smythe? Strickland? Strickland, aye. Nastande? Nastande, aye. That's 10.
It has 10. The bill is out. Congratulations.
Thank you.
We'll move now to item number 4, Senator Yee, SB 888. Good afternoon, Senator.
Thank you very much, Mr. Chair and members. This is a pretty straightforward bill. The state of California, as you know, has a rather large Asian American population. In addition to that, many other individuals partake in Asian noodles. These are the white thin noodles that are manufactured and consumed. Unfortunately, we have state regulators that may be a little overzealous, and what has happened is that they have looked at the rules and regulations and have applied those regulations to the production of rice noodles. And unfortunately, even though this has been going on for over 5,000 years and we've not had any problem, I guess the state regulators felt that they needed to be refrigerated in order to stay healthy. The reality on that, however, is that if you do that, it hardens and you just simply destroy the reason why anybody would eat rice noodles. And so what we have done in this particular bill, and working on a bipartisan basis, have removed any opposition on this particular bill. What this bill will do is to say that those individuals who manufacture these kinds of noodles, they will stamp as to when these noodles were produced. They have 4 hours in which to deliver them to the restaurants or food stores. And with that, urge an aye vote.
I'd like to move Senator Yee's bill.
Second.
We have a motion and a second. Thank you, Senator Yee. Would you like to present witnesses in support?
Just sit down.
Good afternoon. My name is Teresa Say Chow. I'm a board member of OCA Sacramento Advocacy and Public Relations. OCA is a national organization that's dedicated to social, political, and economic justice for Asian Pacific Islanders here in the United States. Today, I'm here to ask for your support on SB 888-YE, Asian Rice-Based Noodles, on behalf of OCA Sacramento and National OCA, which is composed of 80 chapters and affiliates across the states. We believe that it is unjust for California health inspectors to openly go into manufacturer businesses and throw away tons of noodles when they have no real accurate proof that rice noodles are harmful to consumers kept in room temperature for 8 hours. This incident was extremely offensive to the Willie Lu's family when 1,000 pounds of their rice noodles were thrown away, causing them money and inconvenience. Asian rice noodles have been produced over 150 years here in the United States, in California specifically. and we have not heard of any cases that's harmful to any consumers. SB 888E ensures to continue safe production of Asian rice noodles here in California by allowing to be kept at room temperature and delivered to the businesses within 4 hours. So OCA Sacramento will greatly appreciate your support. Thank you.
Thank you.
Mr. Chair, these are the Kinwoo or the owners of the Kinwoo factory in my district, where literally we had health inspectors go in there and shut them down. 9 individuals were laid off because of that, and hopefully this bill will take care of their problem and many other rice noodle manufacturers throughout the state of California.
Mr. Chairman, committee members, my name is Frank Liu. I'm speaking on behalf of my uncle, who have been manufacturing rice noodles in San Francisco for over 25 years. Senate Bill 888 will help our industry maintain its long history of providing healthy rice noodles to consumers of California. Rice noodles are a deep-rooted tradition for Asians for over thousands of years and been served in California for over 150 years. Senate Bill 888 will allow us to continue our business of manufacturing rice noodles for restaurants, and for many of our customers, these restaurants, their core businesses is selling rice noodles. Senate Bill 888 will help them maintain their business as well as help us maintain jobs in our business. Please join us in support of Senate Bill 888.
Thank you for being here today. Other witnesses in support? If the witnesses in support would like to approach that microphone, the floor microphone, please introduce yourself and indicate your support.
Yeah, I'm Richard Lee. I'm the Director of Environmental Health Regulatory Programs for the San Francisco Department of Public Health. I'm in charge of the health inspectors in San Francisco. We're not the health inspectors that closed down this facility. Those were the California health inspectors. The San Francisco Health Department inspectors have treated Asian rice noodles as essentially non-potentially hazardous food for a number of years, and we don't require that they're refrigerated, and but we do require that they're destroyed after 8 hours.
Thank you.
Yeah, and we have not noticed any illnesses in San Francisco or other parts of California.
Thank you for your presence today. Again, at this point, name and organization and voice your support, but we've had our testimony, so no further testimony, please.
Good afternoon. My name is Willa Liu, and I am in support of SB 888. Thank you.
Thank you.
Good afternoon. My name is Alice. I support SB 888. Thank you.
Good afternoon. My name is Tom. I came from Los Angeles. I support the bill. Thank you.
My name is Li Jie Liu. I support SB 888. Thank you.
Good afternoon. My name is Junhong Liu. I support the SB 888. Thank you.
Hello, my name is Terry Liu, and I support this bill.
Hi, my name is Victor Liu, and I strongly support this bill. Thank you.
Good afternoon, Teresa Chi, member of Cathay Post 384, also Chinese American Democratic Club, in strong support. Thank you.
Nicole Wertelman, the San Francisco Board of Supervisors, as well as Mayor Gavin Newsom, unanimously passed a resolution in support of SB 888.
Crystal Jack on behalf of the California Rice Industry Association in support of the bill.
Thank you. And Senator Yee, did your other guest want to also offer his support, or
no?
Okay.
You know
speaking on this.
Okay, great. Thank you very much. I have members Eng and Lowenthal with questions or comments. Assemblymember Eng.
Yes, thank you, Mr. Chair, and thank you, Senator Yee, for bringing this bill forward. I want to tell you that as someone that represents, I believe, the noodle capital of California, which is the Monterey Park, San Gabriel Valley area. Well, let me talk about five-star. I'm talking about five-star restaurants, Senator. I want to tell you that this
We're going to need a
bill,
referee.
will go. We want to thank you very much, because this bill will go far in terms of not just preserving jobs and not just making sure that small businesses continue to flourish, but also to make sure that our cultures are respected. As someone that's consumed this product for many years, I can tell you the worst thing that happened to me is I became a state legislator. So I think that in the spirit of that, I strongly will support this bill. Thank you.
Thank you.
Thank you, Ms. Lowenthal.
Thank you, Mr. Chair. I'm very supportive of your bill, and
I guess, Senator Yee, I'm curious about the Department of Public Health and how well or not they recognize the diversity of the state, the numbers of ethnic groups that make up our great state of California, who all have different foods and food products and foodstuffs that may not be recognized by the Department of Public Health. And I don't know if you've ever looked into the diversity within the department.
Unfortunately, no, I haven't. Let me just say that this is a classic example of where, you have bureaucrats who basically read the rules and they apply it without any consideration to the reality of things. The rules are pretty clear that as soon as you manufacture these particular item, you have to refrigerate, you have to bring down the temperature. The problem with that, however, is that this has been practiced for thousands of years and no one's gotten sick out of it. So why would you then change just because the rules are there? So they just didn't use, I think, a lot of common sense. To the credit of the governor's office, we did contact the governor's office, and they were able to at least loosen a little bit of that monitoring until we get this bill passed. Unfortunately, it's taken this long to kind of get this thing going. In the meantime, you have businesses both in Southern California and in Northern California, my city, where you have a factory closed and 9 individuals are unemployment and not generating revenue. It just didn't make a whole lot of sense.
Well, I appreciate that, and I really hope in the future we could add a component of cultural sensitivity to the state agency.
Thank you.
Thank you, Senator. I failed to ask if there were any witnesses in opposition. Are there any witnesses in opposition? Seeing none, no further committee member questions. Would you like to close, Senator?
Just urge an aye vote.
There is a technical amendment that you've accepted as part of this, and we have a motion to do pass as amended. I ask the clerk to call the roll, and would refer to appropriations.
Monning?
Aye.
Monning, aye. Fletcher?
Aye.
Fletcher, aye. Amiano? Carter? Carter, aye. Conway? De La Torre? De La Torre, aye. De Leon? Eng?
Aye.
Eng, aye. Gaines? Hayashi? Hernandez?
Aye.
Hernandez, aye. Jones? Jones, aye. Lowenthal? Lowenthal, aye. Nava? Perez?
Aye.
Perez, aye. Salas?
Aye.
Salas, aye. Smythe? Strickland? Strickland, aye. Nestande? Nestande, aye.
That has 12. The bill is out. Thank you, Senator. Congratulations. We have one more bill for presentation. We're waiting for Senator Leno. At this point, I would entertain a motion on the consent calendar. We have a motion. Do we have a second? Yes, we have a second. Clerk, please call the roll. This is on the consent calendar.
Monning?
Aye.
Monning, aye. Fletcher? Fletcher, aye. Amiano? Carter? Carter, aye. Conway?
Consent.
De La Torre? De La Torre, aye. De Leon? Eng?
Aye.
Eng, aye. Gaines? Hayashi? Hernandez?
Aye.
Hernandez, aye. Jones?
Aye.
Jones, aye. Lowenthal? Lowenthal, aye. Nava? Perez? Perez, aye. Salas?
Aye.
Salas, aye. Smythe? Strickland? Strickland, aye. Nestande? Nestande, aye.
That has 12 votes. The consent calendar is out. The bill's on the consent calendar. We're now going to move to item number 10, Senator Leno, SJR 14. Good afternoon, Senator.
Committee members, am I incorrect? I thought this was on the consent calendar. No. All right. Just ask.
Nice try. Nice try.
For staffing, clearly. So thank you for the opportunity to present this joint resolution, Senate joint resolution. And it, of course, merely urges our federal government and President and Congress to do exactly that which the President and his Department of Justice has been suggesting. And I would say that this is, number one, first and foremost about states' rights. It's about local control, and it raises the question, in these times of deep federal deficits, do we really have excess tax dollars to be interfering with the provision of a medicine that the voters of California back in 1996 decided they would like to have provided in a safe and accessible fashion to those who have recommendations from their physicians. It would also urge the federal government to add an affirmative defense to medical marijuana charges in federal court. So if by chance the feds have cracked down on you, you're our dispensary, and you're providing this medicine under the auspices of state law, and now you have to defend yourself in a federal court, you can't even raise the issue of medical marijuana as a defense. And so we think that needs to be corrected as well. So just brief history here. You're all well familiar with the passage of Prop 96 in Prop 215 in 1996 by a significant majority of Californians, the Compassionate Use Act. And then with the Senate Bill 420, authored by Senator Vasconcellos, co-authored by me back in 2004, we tried to fill in some of the blanks that 215 left in place, which is, yes, there is state allowance for access to this medicine, but the provision of access was left unstated in Prop 215. With SB 420, we tried to fill in some of those holes. And then as recently as August of 2008, the Attorney General issued medical marijuana guidelines to all law enforcement in California, and these guidelines recognize the legality of collective and cooperative distribution and provide recommendation on how to comply with state law. So even with President Obama's direction to his Department of Justice, we still see these federal raids. And so I recognize it's not in our jurisdiction as a legislature to end those raids, but we certainly as a legislature can use our voice to put ourselves on record as saying this is a waste of federal tax dollars, that this is all according to auspices of state law. It is a states' rights issue with regard to health and well-being of our citizens, and additionally that how these dispensaries operate should be decided upon land use issues at the local level. And lastly, I just want to point out to you that not only did voters support Prop 215 in 1996, but in recent field polls of 2004 and then a Zogby poll in 2009, 74% of Californians approve of legal marijuana use, and with the Zogby poll, 72% want the president to end the federal raids of medical marijuana providers, and that was January 2009. So the voters are on our side with this resolution, and I would ask for your aye vote today.
Thank you, Senator. You have some witnesses in support?
Yes, I do.
If you'd like to present them.
Sure, Mr. Don Duncan, who is the Director of Americans for Safe Access.
Thank you. Mr. Chairman, committee members, my name is Don Duncan. I'm the California Director of Americans for Safe Access. We're the nation's largest organization of medical cannabis patients, doctors, and researchers who are working to reform medical cannabis laws. I'm here today to ask you to support SJR 14, which calls for an end to federal interference and other important changes in the federal policy towards medical cannabis. Federal interference blocks our state implementation and our appropriate regulation, and we need a call on the federal government to change this policy of interfering, whether it be in banking, in the courts, or with the other sorts of intimidation of property owners and criminal raids. The primary impediment that we have right now to implementation is this federal interference. It's so important that the state of California be on the record calling for these changes. Congress and the administration are moving in a direction of a new federal medical cannabis policy. We can hope for a more reasonable policy, and SJR 14 gives Congress that advice at a very important time in history when we're finally seeing that move in our direction. You may already know about a memo from the Department of Justice in October of last year outlining new federal enforcement guidelines, policies and advice for agents and for prosecutors. In addition to that Department of Justice memo, we see legislation moving forward in Congress recently for the first time. Sam Farr's H.R. 39 39 that would provide the affirmative defense referenced in SJR 14. HR 2835 by Barney Frank that would call on the federal government to respect the laws of the states that have adopted medical cannabis policies. And just recently, on May 24th, a letter by Representative Polis asking for an end to banking interference that is the latest impediment to collectives and cooperatives and medical cannabis patients obeying state law. It's important that you understand that SJR 14 is not a referendum on medical cannabis. It is not a referendum on cannabis collectives and cooperatives. It's just a very important policy position that's very timely for the state of California right now. And so while the implementation of medical cannabis is controversial, I hope this resolution will not be. And I would like to call on you today to help us regulate medical cannabis in California, implement the laws that we have on the books already by supporting SJR 14 to send the proper message to Washington, D.C. Thank you.
Thank you. There's a motion and a second, please.
My name is Derek Can. I'm the General Manager at Capital Wellness here in Sacramento. Chairman Moaning, I would like to ask you and your colleagues to support SJR 14 calling for an end to federal interference and intimidation. Capital Wellness Collective is a legal cannabis association here in Sacramento working hard to uphold the letter and spirit of California law. Recent federal intimidation caused 2 banks to drop our accounts. This makes it difficult to operate in a legal and professional manner. We need you to tell Congress to stop this interference so that Sacramento and other jurisdictions can regulate medical cannabis to prevent abuse. This issue is important right now because 15 members of Congress sent a letter to Treasury Secretary Geithner calling for an end to this interference in May. SJR 14 will support this effort at federal reform. I ask you again to support this resolution. Thank you.
Thank you. Other witnesses in support?
Hello, I'm Lynette Davies with Crusaders for Patients' Right. We are an organization here in Sacramento, and we strongly support this resolution. Thank you.
Thank you. Any other witnesses in support? Any witnesses in opposition? Seeing none, any questions from committee members? Mr. Nastande.
Thank you, Mr. Chair. I guess the question is if the Attorney General and the President has said the policy is to stop these raids, why is it happening? And second of all, are they going to listen to the California legislature more than they do the President?
First question first. Though at times it is disappointing, we see that certain things are said, but other things are done. So we'd like to see a greater consistency between some of the rhetoric coming from the President and the operations of his Department of Justice. I don't doubt that he would like to see these raids ended. He has said so. They have not ended entirely yet. And with regard to your second question, Mr. Nastande, it's completely appropriate. It's not uncommon for the legislature, through the auspices of resolutions, to express our opinion in the form of urging our Congress and the President to do this or that. And this, given that a good number of these federal raids, if not a majority of them, are happening here in California, I think we are abrogating our responsibility to speak up, given we have the opportunity to do so, and we have that opportunity today.
Sure, and I appreciate your second point, but back to the first point, do you think that you mentioned rhetoric? Is it just rhetoric from the President, or is he missing something in the line of communication?
Time will tell. I don't know exactly why. I don't know, but we're frustrated. And, property owners, private property owners, are having their property confiscated from them without due process as a result of these raids. They're being threatened that if they do sign a rental agreement with a dispensary, all per land use issues and current law at a particular local agency, that they will have the threat of confiscation of their personal property. So again, this is really about the intrusion of an overreaching federal government in our lives right now.
Well, I get my hesitance in supporting this is I think there must be something else going on, that if the President says this is our policy and the Attorney General says, and they don't do it, I think maybe they're still going through some internal battles that have not been cleared up yet. Maybe there's something there that we don't know, and that's my hesitancy.
And my point exactly, that given that most of these raids are happening in California, that California was the first state by voter initiative to allow for the compassionate use of medical marijuana, that our silence would be conspicuous. It's time for us to speak up.
Thank you, Mr. Chair.
Thank you, Mr. Nastande. Any other questions, comments? Hearing none, would you like to close, Senator?
I would ask for your aye vote.
Thank you. We have a motion and a second on the floor. This is to adopt Senate Joint Resolution 14. Please call the roll.
Monning?
Aye.
Monning, aye. Fletcher? No. Fletcher, no. Amiano. Carter. Carter, aye. Conway. De La Torre. De La Torre, aye. De Leon. Ing. Ing, aye. Gaines. Gaines, no. Hayashi. Hayashi, aye. Hernandez. Jones. Jones, aye. Lowenthal. Lowenthal, aye. Nava. Perez. Salas. Salas, aye. Smythe. Strickland. Strickland, no. Nastande. Nastande, no.
That has 8, needs 2 more.
I noticed that a number of members were not present. Are they here today, or are they not in committee?
They have not arrived at committee yet. We do have a couple of other bills on call. We're going to lift the call on those, and we'll keep the committee hearing open for a short time after we lift the call on these.
Are there other bills to be presented or just
no,
calls
this
to be
is
lifted?
it. You're the
All right.
final bill for presentation. We're going to lift the call right now on the other 2 bills.
Get to work. Thank you, Mr. Chair.
Yes, thank you. Okay, before members leave, we do have 3 bills on call. We'll start with item number 2. That is Senate Bill 56, presented by Senator Alquist. I'd ask the clerk to call the roll of non-voting members.
Fletcher. Conway. De La Torre. De La Torre, aye. De Leon. Gaines. Gaines, no. Hayashi.
Aye.
Hayashi, aye. Nava. Perez. Perez, aye.
That has 11. Item 2, SB 56, is out. We're now going to move to item number 6, SB 1169 by Senator Lowenthal. Ask the clerk to call the roll of non-voting members.
Conway. De La Torre. De La Torre, aye. De Leon. De Leon, aye. Gaines. Hayashi.
Aye.
Hayashi, aye. Hernandez. Hernandez, aye. Nava. Perez. Perez, aye. Smythe. Strickland. Strickland, no.
The Lowenthal bill. That has 12 votes. The bill is out. That was Senator Lowenthal's SB 1169. I'm gonna. Pardon? Do we have any more members?
I could have two Lenos.
Let's lift the call on item 10, SJR 14 by Mr. Leno. Please call the roll for non-voting members.
Amiano. Conway. De Leon.
Aye.
De Leon, aye. Nava. Smythe. That's 9.
That has 9. It stays on call. We're going to keep the agenda open here on call for another 5 minutes or so. If any members want to add on at this point, please approach the clerk respectfully, and she will take you through. Thank you. Good afternoon, Mr. Amiano. We're going to lift the call on item 10, SJR 14 by Senator Leno. Ask the clerk to call absent non-voting members.
Amiano? Aye. Amiano, aye. Nava? Smythe? That's 10.
That bill has 10. It's not a bill, it's a resolution, is out. We're ready to adjourn. Assembly Health Committee stands in adjournment.